Assalamu alaikum. My name is Anmol Fatma and my roll number is BP1650032 and my group number is 42. The topic which is assigned to us is psoriasis and the topic which I am discussing is plaque psoriasis. Now, what is plaque psoriasis? Psoriasis is a skin disease that affects about 7 million Americans. It comes in several forms. Plaque psoriasis is the most common. Plaques are raised red patches covered with a whitish buildup of dead skin cells called scale. They usually show up on your elbows, knees, scalp, and lower back, but you can have them anywhere. Plaques often itch or hurt. The causes of plaque psoriasis. Doctors aren't sure why people get plaque psoriasis. It's considered as autoimmune disease. That means your immune system attacks healthy cells as if it's fighting an infection. This causes new skin cells to grow much farther than normal and they build up in thick patches. Whether you get plaque psoriasis depends on your genes and on your health history. If it's hereditary, then psoriasis seems to run in families. About 10% of people are born with genes that make them likely to get psoriasis, but only about 3% of people get disease. Triggers. Some things has to happen to start your immune system reactions. Sometimes if it's an injury to your skin and or a bad sunburn, it could be a certain medicine like lithium or malaria drugs. An infection, particularly strep, can bring on psoriasis. So can have high levels of stress. Psoriasis isn't contagious. It can't be spread by touch or other close contact. The diagnosis of plaque psoriasis must be a dermatologist. A skin doctor can be usually tell if you have plaque psoriasis just by talking with you about your medical history and looking at your skin. But since psoriasis can look like eczema and other skin diseases, diagnosing it can be difficult. In some cases, your doctor may need to do biopsy. They'll take a tiny sample of your skin and look at the cells under the microscope. The treatment of plaque psoriasis can't be cured. You'll probably go through cycles where the rash looks better and then clears up again. The goal of treatment is fewer and less severe flares up. You may get medicine to put on your skin and you may take pills or your doctor may recommend a combination of those. Treatment options include topical medication. Topical medications, if you have only few plaques, your doctor will probably try a prescription cream first. You put these directly on your skin. They can help with inflammation or slow the growth of skin cells. Examples corticosteroids, vitamin D, vitamin A, and insulin. You can also try over the OTC topical medicines. Salicylic acid and coal tar are approved to treat psoriasis. Other ingredients may soothe itches and remove scale, including aloe vera, jojoba, zinc, parathione, and capsaicin. Topical emollients that you put in after a shower or bath can help keep your skin moist. The other is light therapy. If the rash is more widespread, your doctor may treat it with UV light. This is done at your office or with a special box you can keep at home. You may also get relief by going out in the sun, but this can raise your skin of skin cancer. Watch how long you can spend outside and cover up or put a sunscreen on places where you don't have plaques. Next is systemic drugs. If you have a severe case of plaque psoriasis, you may need medicines that work throughout your body. They calm your immune system or make your skin cells grow more slowly, but they can cause serious side effects like depression, aggressive thoughts, liver problems, or a high risk of skin cancer. You take systemic drugs like acetretin, cyclosporin, and methotrexate by pill, or your doctor will give you a shot. Biologic drugs also can cure psoriasis. Another is another kind of systemic drug or also target your immune system. It includes adalimumab, Humira, brodalumab, Silic, etanercept, and guselkumab, Tremfya, infliximab, Remicade, and ixekizumab, Tels, rising Rosa, Skyrizi, and etc. They are given in a shot or through a vein in your arm. They affect a specific type of immune cell or keep certain proteins from causing inflammation, but these drugs can make it harder for you to fight an infection. The precautions which we might take from plaque psoriasis are most people who get plaque psoriasis have it for the rest of their lives. You can do few things to deal with it better. Avoid triggers. Things like stress and smoking don't cause psoriasis, but they can make it worse. Try to figure out what triggers your flares up. You may be affected by alcohol, allergies, cold, dry weathers, and hormones. Watch your diet. Take care of your skin. Symptoms include red raised inflamed patches of skin, whitish silver scales or plaques on the red patches, and dry skin that may crack and bleed, soreness around patches, itching and burning sensation around patches, thick pitted nails, and painful swollen joints. There is a case study of a 50 years old woman present with a history of long-standing chronic plaque psoriasis. Since the age of 16, she has had numerous topical treatments which have not adequately managed her symptoms. Over the past 18 months, she has noticed swelling and pain over the proximal joints of both hands, which is much worse in the morning. On examination, she has early signs of deformity. NSAIDs have not alleviated her symptoms, and her function at work is now affected. What management options should be offered for this patient? The subject is female, age is 55 years old, chief complaint and complaint is chronic plaque psoriasis. History is since the age of 16, she has had numerous topical treatment which have not adequately managed her symptoms. Over the past 18 months, she has noticed swelling and pain over the proximal joints of both hands, which is much worse in the morning. In object, we have no vital signs or lab reports. In assessment, we assess that swelling and pain over the proximal joints of both hands is due to the psoriatic arthropathy. Psoriatic arthropathy affects up to 30% of the patients with psoriasis. The resulting pain and functional disability of this arthropathy can be debilitating. In plan, we recommend NSAIDs to improve symptom control. Other treatment and options include methotrexate, cyclosporin, and TNF-alpha antagonists. These medicines would also have a beneficial effect on this patient's psoriasis. Both rheumatology and dermatology services are required in the management of such patients. Thank you.